In a nutshell, what ACHA really wants to do is transform outcomes in congenital heart disease. And what I mean by that is we want to make sure that everybody born with congenital heart disease lives a long and full life. The way we think we're going to get there is through better care, more research, and more options for patients. And what we need to drive that is information.
The Adult Congenital Heart Association is really in a unique position because it's really one of the only patient organizations at all, that focuses solely on congenital heart disease. The message has been clear and consistent and strong for the need for more research across the lifespan, as well as for funding for surveillance, so that we can have a better idea of exactly what the population of congenital heart disease is at any age.
Well, to me, ACHA is reaching out to adult patients with congenital heart disease who may be struggling on issues that others have struggled with, and giving them the tools and that which empower them to be able to take charge of their life, take charge of their health care, to be able to live their life well into their 50s, 60s, 70s, or even 80s, and live it fully and get satisfaction out of just being alive.
ACHA worked with multiple organizations to help draft some legislation, and against all odds, it was introduced, which is remarkable in and of itself. And we were told doom and gloom, maybe it'll get addressed in 5 to 10 years, but within 12 months we had our law passed. And it is solely due to the amazing advocacy efforts and the wonderful advocates that we have who work so hard on behalf of the Adult Congenital Heart Association. The other thing that I think our advocates have done is just truly raised awareness at the federal level. We have members in the House and members in the Senate who are committed to fighting for the issues related to congenital heart disease, and that's truly tremendous given the relatively short amount of time we've been working on this. So the law was passed a year and a half ago, and then there was no funding tied to it. So in this horrible budget climate, we were told, oh, you'll never get it funded. And again, with the last budget cycle, we were given $2 million above and beyond the current CDC budget strictly for congenital heart disease surveillance and data collection. So just remarkable. Lobby Day is kind of the culmination of all advocacy efforts. There's a lot of things that you can do as an advocate. You can contact your legislators through email, through social media and Facebook, by making phone calls. But it's really about developing that personal relationship, and the best opportunity to do that is in person. And when you make the trip to Washington, D.C. to meet your member of Congress in person, it's showing the sacrifice and commitment and sharing your story that makes a real profound difference and lasting impression on the member of Congress, and hopefully moves them to action. Well, I think the unique thing that patients can provide is their story, and it's absolutely important when they're feeling comfortable and in a position to do that, to share their story. There's so many ways that we can use their story, but their story puts meaning to the message that we're trying to share.
Sometimes people say to me, well, I don't need to be involved with Adult Congenital Heart Association or your work because I'm doing fine. No, we do need you, because the only way we are going to raise awareness of this issue in the United States is if those of us who are affected, and our families and our friends and our relatives, speak up.
To me, being involved in ACHA means helping other people to be able to find that voice, to empower them to be able to take care of their own health, and to know that they can make something out of their life, that they don't have to live feeling like, number one, they're alone, because they're not. And that's the first thing I would say to a member who calls, is you come to the right place. You are not alone, and we can help you to discover the tools that you need to be an advocate for your own health.
And that's why the CDC has made congenital heart disease a priority, because it can serve as a model for other birth defect areas as well as other chronic diseases. So I think we're uniquely positioned, having the louder voice for the lifespan issues, to really make an impact that will affect people far beyond congenital heart disease.
Congenital heart disease, #1 birth defect, as common as HIV/AIDS, #1 cause of infant mortality. It's time to do something about it now, and we all need to speak up, and we need to speak up loud.